Hi there, my name is Vic Veer. I'm a surgeon that works for the National Health Service and I help people with snoring and sleep apnea problems. And today I want to tell you about CPAP. Now, I don't normally talk about CPAP because it's not really my area of expertise, but I want people to understand that I'm not anti-CPAP. So a lot of people think, oh, you're a surgeon, therefore you're trying to get people off CPAP. You think CPAP's rubbish and you're trying to help people get off it. No, that's not true at all. Nothing could be further from the truth. CPAP is great, and I want to explain what my relationship as a surgeon is with CPAP, and hopefully you'll understand a bit more. Now, to have an operation that completely cures your snoring and sleep apnea is quite difficult. But however, getting someone to help them use CPAP is much, much easier. You don't only have to go this far rather than having to go all the way here to cure. If I can help people use CPAP so it's comfortable, they don't have problems wearing it at night, that's much easier for me to achieve than to try and cure someone all the way down to an AHI of 1 or 2 or something like that. So using CPAP is, I'm going to bring you down to the point where you find it comfortable to use and you don't want to carry on any further. That is an easy stop for me for a lot of people. And a lot of people say, look, all these other operations you talk about sound horrible. I'd rather stick to this one. So that's an easy plus for me. If I can get people to use CPAP, that's very easy. And I'll do another video on how I help people go from, I can't use CPAP, it makes me feel there's air leak and I can't breathe and feel claustrophobic and suffocated with this mask on, to the point where, oh, this feels very nice, the pressures are a lot lower and I can use this. And I'll talk about that in another video about how I deal with it from a surgical point of view. Our next thing I need you to understand is that surgery isn't an instant fix. People don't sit up from the operating table and go, oh yes, well my wife will be pleased, and just walk out. It doesn't work that way. It takes at least 3 to 6 months for the effects of surgery to help people with obstructive sleep apnea and snoring. I mean, some things are a little bit quicker than that, like removing very large tonsils or something like that. But on the whole, it takes quite a long time for the effects of surgery to manifest themselves into good improvements that you will notice at home. So during that period, there's 3-6 months where you're not having treatment for your obstructive sleep apnea, and that can be difficult for your body to tolerate. So using CPAP whilst you're waiting for your operation is a good idea, because you're protected during that time and you're not sitting there hoping for surgery to happen, and you're not being treated for those months while you're waiting for the waiting list to catch up with you so you can get your turn to have an operation. Now, I think a lot of people know that having obstructive sleep apnea causes significant harm to your physiology. It makes your blood pressure go up, gives you diabetes, puts a lot of pressure on your heart. And there's even studies where people have done ultrasounds on the heart and then giving them CPAP 3 months later, look at it, and then the pressure on the heart has come off, and the heart's no longer having to pump so hard to get blood around the body anymore. And that is seen within 3 months of using CPAP, probably shorter than that if they use it well straight away. These sorts of things make a difference, because if you're going to have an operation and you've got all these things going, your blood pressure's high, there's a possibility of diabetes, which causes infections during operations, your heart's under strain, and then you have an operation which can be quite big in the throat, you're not going to deal with that very well. Your physiology isn't really set up for a big operation. And so therefore, you really should use CPAP for at least 3 months prior to an operation, as much as you possibly can, to make your risk of having that operation as low as possible. Because within 3 months of using CPAP perfectly, you'd be back to almost like a normal person having this operation. Whereas if you have obstructive sleep apnea, you go into an operation without using CPAP or any sort of therapy for your obstructive sleep apnea, you've got much higher risk. So even if you're having your knee replaced or a hernia done, or something simple like that, you're much more likely to have problems with those operations. So it is really worth doing those sort of at least 3 months of good quality CPAP use prior to an operation, so you've optimized yourself to have that operation and get through it with as minimal risk as possible. So I've talked about using CPAP before an operation. What about after an operation, or just immediately after an operation? I think that's a good idea as well, because if you think to yourself, you've just had an operation, I know that it takes about 3 to 6 months for that operation to take effect to help you with your sleep apnea. But if you've got sleep apnea and there's not an awful lot of oxygen going to your system, there's not enough oxygen going to the tissues in your throat, if I've just removed an area from the back of your throat and stitched something together to try and hold everything in the right place so it doesn't keep collapsing down, well then how's anything going to heal if no oxygen is getting to there? If you spend half the day sleeping and after day you're actually blue, then how's that going to help the back of your throat? You need oxygen to get to areas so that it heals and things knit together. So you do need your CPAP even after the operation. There's lots of evidence out there that says using CPAP even after a nose operation or a hernia operation, like I said before, or indeed any throat operation, helps the recovery. It means that those people do better. Their surgical outcomes are better. Their risk of having strokes and heart attacks after the operation are reduced. It's all important to keep using CPAP, because the idea is that once you're healed from your operation, you can slowly wean yourself CPAP and slowly wean yourself off the CPAP, so you can see how much of an effect the operation's made for you. Now, the next point is, I guess, slightly more esoteric, because I think the conversation that you have with someone who is on CPAP and then is going to have their operation is very different from the people who are untreated with obstructive sleep apnea and then want an operation. Put it this way. A lot of people who have just been told they've got obstructive sleep apnea, they think, oh, I can't deal with this CPAP problem. I really want an operation. I'm really worried that my life expectancy is reduced to 58 years or 59 years old now. I'm worried I'm going to get a heart attack. My father had a heart attack. He had sleep apnea. All these thoughts go into people's minds. They think to themselves, I don't think I can tolerate this CPAP. I'm really scared. I want an operation. I'll go and see someone. I'll get an operation, get it all fixed. Now, in these situations, I don't think that's a particularly healthy conversation, because when you're scared like that, you're almost willing to accept these slightly higher risks for having an operation. And really, it's not a particularly healthy conversation, because people are desperate and they will say yes to anything just to cure or get rid of this anxiety of their problem. Contrast that with people who have used CPAP. I've helped them use CPAP. They're using CPAP for 3 months. And then we talk to them and say, look, you've used CPAP for 3 months. How are you getting on? And they go, yeah, I'm using it. I don't particularly like wearing a mask at night, but I know I'm safe. I know that if I did go for an operation, it would be safer. But now I have to think to myself, look, this is really a quality of life thing. I'm using CPAP. I know I'm safe. And now I have to contrast that. Well, I can get off this CPAP and have an operation instead. Is it worth it? Is it worth it for me? Because there are lots of risks and complications of having an operation. Or I could just stay on my CPAP, which I'm now tolerating well and I'm happy with. So it becomes, rather than, oh God, please save my life, to this is a quality of life thing, and let's talk about the pros and cons of it. That is a much healthier conversation, as you can imagine. If you're in a safe place and you're deciding whether an operation is a good thing for you or not, it's better than, oh, this is a life-saving operation, let's just do it. So as you can see, it's very different from a surgical point of view, and I think I get more sort of proper conversation with people, and it's a more informed decision-making process. So I think that's important when it comes to these sorts of operations. So you may have realised from this video that a lot of patients I see say to me, look, I've been told I've got obstructive sleep apnea. I just can't use this CPAP device. I want you to just fix it, just remove whatever you need to remove, just do any operation you want, just fix it. But really what I do is that I say, okay, let's get you onto CPAP. Let's get it so it's tolerable for you. So you're using CPAP first, and then later we can take you off it again. And the reason I do that is because I'm edging you towards normality. I'm not trying to do one operation that will fix everything, because the risks can be quite high when you do such a big operation, and there's a bigger chance of it failing. What I'm trying to do is say to people, I'll get you using CPAP because it's a lot easier. And as I said, I'll do another video on that some other time. I'll get you using CPAP, and once you're using it, then you're safe enough for a sort of proper operation later on, so that you can have an operation to get you off the CPAP. Now, hopefully that sort of makes a bit of sense. A lot of people, as I said at the start, I'm not an anti-CPAP person at all. In fact, most people who actually can use CPAP tolerably and are comfortable with it end up saying, well, actually, I don't really want an operation. I'm really happy with CPAP. And that's great, because I've helped someone get to the point where they're happy and they don't need a big operation. They don't need to have something awful happening to them. On saying that, there are people out there who really, really can't imagine a life with a CPAP on their face for the rest of their lives, or no matter what I do, I can't get them to that point where they can use CPAP tolerably. In those situations, I say to them, yeah, okay, I'll still do your operation, but you just have to accept that there's slightly higher risks compared to people who've used CPAP and then have an operation. So it's not that I'm discounting everyone who won't use CPAP. Of course not. Most of my practice is helping people with obstructive sleep apnea, whether they use CPAP or not. And the reason why I personally do it this way is I think people who, particularly who've got very, very severe obstructive sleep apnea, there isn't just like one problem that solves their sleep apnea problem. It's not like, oh, just remove this and that'll be the end of it. And so equally, CPAP is maybe not the answer for them. Sometimes it needs CPAP, it needs a bit of surgery, it needs them also to lose weight, it needs all sorts of positioning in bed. And what you're trying to do is edge them closer towards normality, as I said before. So I tend to do lots of small operations. So maybe I do a small operation to help them use CPAP. Then they're suddenly able to use their CPAP. They can breathe a little bit better. They end up losing a little bit of weight because now with their sleep apnea slightly better, they're able to lose a bit more weight, whereas prior to that, it's impossible to lose weight when you've got sleep apnea. So as you get closer and closer, then you say, okay, you've plateaued off, you can't lose any more weight, you're not getting any better from that point. Let's do something else if you're still not really happy with what the situation is. And then you edge towards, as I said, normality. And with a smaller operation, which is much more tolerable for people, not so painful, you can get to the point where, I've done a bit of an operation, I've lost a bit of weight, I'm now improving and I'm edging my way towards where I want to be, where I can rest and I'm happy for the rest of my life. And that's much, rather than going for some sort of heroic operation, which is, it sounds great, but it's not true in real life. It doesn't work that way. I think a lot of people may not know this, but obstructive sleep apnea stops you from losing weight. It actually encourages weight gain. So being told, you need to lose weight and go away and lose weight, that's the only problem. It doesn't work that way. Losing weight, even if you've lost all your weight, will be only a 30-40% improvement in your sleep apnea. It's just one of the factors that are influencing the problem that you have. It's causing an impact, but it's not the sole cause of your obstructive sleep apnea. If you want to know more about that, I've got a video here about obstructive sleep apnea and weight gain and weight loss. And I've got another video down here about your sleep study. If you understand your sleep study, this is a chronic condition. You've had it for the whole of your life or the rest of your life. Understanding what your actual problem is rather than just, look, this is my AHI, this is what it's all about. AHI is often wrong. So have a look at that video as well, and hopefully you'll understand a little bit more about sleep apnea and what you can do about it. Okay, take care. Thanks a lot. Bye.